Yeah, so this happens a lot. So a person becomes suspicious of Lyme because of their symptoms, right? And the big symptoms are headaches, migraines, joint pain, muscle pain, fatigue, and then neurological symptoms. So we get POTS, dysautonomia, dizziness, these kind of things. So really a lot usually is happening. You go into your doctor, you say something's wrong, and they run a battery of tests. If you get a Lyme disease test, you usually get the screener test, which is something I don't like because I think it misses a lot of people. I don't think it's a very good protocol. Then if that's positive, you get the follow-up blot. You need to have so many bands positive. We know that this misses about 40% of patients. It's not a very good standard. And here's what I believe is happening. When patients come into us, what we find very routinely is that they have a co-infection with the Lyme disease. These ticks are just kind of dirty little creatures, and when you get bit by one, you get a magic present of 3, 4, 5 bugs, all in this kind of unique little cocktail to you. Now there's research studies both on Bartonella and Babesia, which we may talk about later, that show that both these diseases lower adaptive immunity or lower B-cell antibody production. Okay, so what's this mean? If you lower antibody production, then you run antibody tests, the tests will look low, which means they'll look negative. So for so many patients, and I looked through last year, over 90% of our Lyme patients had a co-infection with the Lyme disease. And I think that's because we're seeing mainly people who are kind of falling through the system. So if you have one of these co-infections along with Lyme, the co-infection pushes down your antibodies, which makes all the standard testing not as accurate and makes you look negative even though you don't feel good. Now, the other part to these studies that's interesting is it also raises inflammation while lowering the antibody response. So what happens is you actually feel worse than just Lyme disease because the inflammation's higher, but the tests are negative, which is a terrible combination.
Mm-hmm. Not knowing what you're dealing with can be really wreak havoc on a person's psyche.
Yes, not knowing what you're dealing with makes it really hard to be specific. And we find this on both ends. So what happens is the normal tests are negative, and you'll get this a lot if you read some Lyme disease literature or books. You'll get, well, the tests aren't good, the tests aren't good, the tests aren't good. So you actually even have a lot of alternative Lyme people who don't test, who just go, well, the tests are crud, so it's a waste of money, it's a waste of time. I strongly disagree with that. I think if you're running higher quality, more sensitive testing, you can do PCR testing, and you can look for this inflammation that's happening at the same time. So by running just better testing and looking a little more thoroughly, you can uncover these things that you know are a little bit hidden. What we really suggest if you're having a hard time pinning this down is, one, run a little bit more sensitive tests, and usually that means you want something that's quantitative. So this means instead of just being positive or negative, it gives you some kind of number value. This is very useful because what you can do is you can take that number value and then you can go through a trial of care. So you can go, okay, my Lyme disease test is supposed to have 5 bands on it. I have 2 bands and then another one that's got this partial thing. So I've got like 2.5 bands, for an example. Or my Bartonella test, it's supposed to be above 1, I'm at 0.5. So I'm not above the threshold, but I'm suspicious based on my symptoms and things like this. Okay. So what you do is you take your test, and instead of comparing you to everybody else, the best way to do it is compare you to you. So what we do is you take your first test, and then you go through a trial of care. Let's say 2-3 months. Then what you do is you retest. Now what happens most often here, because remember, these co-infections are subverting or reducing adaptive immunity. Well, so if you start to pick at them, you can negate that adaptive immunity suppression. This means the antibodies will come up. So on the retest, what happens to so many patients in our world is the retest shows it more clearly, meaning the numbers typically go up on retest. Every once in a while I get a free one where all the tests go down and they feel great. I'll take it if you're just better in 2 months. Not statistically the way it works out all the time, but it's always nice when somebody does that. Usually what happens is on the retest you see it more clearly. Then sometimes some people even hit CDC positive and they go, oh, you're positive. And they go, did I catch it in the last 2-3 months? And I go, odds are on no. It's more revealed now. It's already been here. It was just hidden before. Yeah, and this is really why we like retesting. My big problem with most of my conventional colleagues for Lyme disease is I don't think they retest enough, because I really believe that you can track some of these values with what your immune system's doing by retesting. Both the inflammation markers and some of these lab markers. So if you have a Lyme test, people go, well, if you're positive, I want you to go negative. This should make sense in most people's mind, but it's also nice if you test and it gets more positive, because you're going, okay, it's working, but it's also telling you in general, you're not done.